Hi, Gary Dupuy here again, here to talk COVID today. Let's start with how COVID is transmitted. It is transmitted primarily through close, intimate, sustained interactions, likely minutes of interaction, not seconds. Um, while it is possible for COVID to be transmitted through airborne particles, uh, that is not the primary way it is transmitted. It is typically transmitted through droplets, and droplets require a sustained interaction. Contact tracing tells us worldwide that it is primarily transmitted through direct contact, and the primary transmission seems to be older adolescents to adults. Back in April and May, before things were better understood, kids were deemed super spreaders because they do carry it in high amounts. However, since this time, it has become eminently clear that kids are not super spreaders, and in fact, because they're such a healthy population, they are really not overly ill with COVID. COVID is mostly about risk factors, regardless of age. As one gets older, we tend to develop more physiological issues such as kidney disease, diabetes, uncontrolled hypertension, obesity. These are the factors that seem to predispose the most to COVID. And because kids don't have these things as much, they don't seem to be as vulnerable. And national statements strongly support kids being back in school, as we feel the social, emotional, and academic benefits of in-school learning far outweigh any risk. Having said that, the risks are not zero. Just like when you get into a vehicle, there are risks, but there are risks you know about, and you take steps to mitigate by stopping at stop signs, stopping at red lights, doing a speed limit, hopefully, having situational awareness and not accelerating from a green light until you're sure everybody has stopped. You also layer your protection by wearing a seatbelt. And the same is what is needed with COVID. What studies show over a 10-year window going back to MERS and SARS and now COVID is that coronaviruses are shared through close, intimate contact, and the number one protective measure is what is termed social distancing, which means 6 feet apart or more, particularly in public spaces when you're around people you're not normally around. That is not always easy to accomplish, so you layer your protection by the addition of a mask. A mask is also shown over and over to be protective. And then lastly, you wash your hands upon exiting that public space, or if you're in it for a sustained period of time, then you have periodic hand washings. And these are ways you protect yourself against COVID. So social distancing, mask wearing, and washing hands. 3 simple steps.